Sridevi mentioned about the format for the day, right? I just want to give a quick overview in terms of, to come up with this format, what went on behind the scenes as well, right? We try to pack inspirational and educational series into this. You probably just see the name of the investor and the topic they're going to talk, but the way we partitioned the entire session for the day is we wanted to make sure you get inspired by successful entrepreneurs. Just come up and talk about their success story, right? That should keep the crowd inspired. And the second stream that we choose was should be informative and educative and interactive. So we've tried to sandwich both of them. We would have preferred to have an inspirational speech in the first day in the morning, but all entrepreneurs are busy out there, and we try to do whatever best we could. So I'm going to start about customer acquisition strategies. This is more an educative session in terms of what worked in the past, what will what are the different areas that could be done. I'll try to be more louder if this is fine. I don't want you to just stick out there. Am I audible here? Yeah, pretty good. Okay. Is it now clear? Loud and clear? All right. So few things that I just want to quickly brief about myself, then followed by that we'll get on to the actual content of the session, all right? Sridevi gave a generous introduction. Suresh talked about a few things that I did here as well. My areas of interest I wanted to talk about. There are three areas that I focus on. Wireless communication, one of my areas of interest. I have machine learning as well as the healthcare, technology and healthcare. I'm not in the brick and mortar healthcare. These are my three interest areas. That's the reason that I also choose to stitch this entire program together and then come up and also talk about some points of customer acquisition that I have personally gone through, right? So we all know about marketing and sales, right? Customer acquisition, a lot of you, I see a lot of senior people here. I'm sure you already know about customer acquisition, but for people who are starting up at a bootcamp level, right? A lot of us understand there's marketing, there's sales. There's marketing, there's sales. There's marketing, there's sales, right? I try to draw differences between marketing, differences between sales, and then I try to go back and step back, look forward, and see what do we do to even get there, right? Let's take this example of this event, right? When we started this event, first question that I asked Sridevi is, how do you find these guys? Where do you find? Yeah, I'm ready to do a healthcare bootcamp, but who will participate, right? That's when we try to do, okay, we need to understand who can be part of this session, right? We had a small plan. If I have to take out my notes, I have lengthy emails, communication between me and Sridevi that goes back and forth. Okay, first let's try to identify the people and then try to approach them. When we try to approach them, that's when marketing is required, right? Marketing is a little more, I reach out at a broader perspective, but even to reach out, we had to do some background in terms of whom to reach out, right? Where are these guys available? But marketing comes in when we are really, really reaching out. I'm sure you have similar problems that goes on at your startups as well. And then finally, when we know we have done a reach out and we know there is a customer interest expressed, that's when it's a short call for Sridevi probably, or some of you probably have a long call to close the deal and then sign you up for the session, right? So we went through customer acquisition strategy as well while we tried to even put this event together, right? So it's acquisition strategy. What I would say is, it's to me it's beyond marketing, right? To me, marketing comes in when you have an execution plan really to go market, right? Beyond that, you really need to have some level of acquisition strategy. So the definition for me to have customer acquisition is, first thing is I need to understand, right? I need to be able to attract, right? And then followed by that, I need to convert or acquire and then retain, right? So part of it, attract, marketing could be, right? Marketing comes in when we really want to do this attraction, and then convert, yeah, sales part comes in where you actually do the conversion, right? When you want to pitch and convert, and then retain, yeah, when you have an yearly renewals or maybe a monthly renewals. When we have a second boot camp, that's the challenge for us to retain you guys, right? So far we have just done 2 steps in this process. First, we were able to advertise, right? We were able to attract, and then we were able to convert. If you are here successfully, that means we were able to convert, right? So how many companies here are attract, convert mode still, and how many are you in retain mode? Can I see a show of hands on how many are in attract mode? Most of you should be attracting customers, right? Conversion mode, you're actually doing a lot of sales. Conversion, very few on conversion. Retain, wonderful. So we have people who are in all these 3 stages, right? If I may ask, what are the challenges in attract? Anybody wants to share the challenges in attraction? Yes. Sorry. Reaching out to the right people, right? Knowing where your first thing is you need to identify where your customer is, and then you need to be able to reach him. Okay. What are your challenges?
I feel healthcare is a service industry. I mean, so customers require that trust to believe in something, whatever you are selling. They have to believe in it. So attraction itself becomes a little difficult. If you can establish the trust part, you can convert them. Yeah. Once you convert them, you give them 100%. That's usually not possible in healthcare, but you try try doing it. That's where the retaining part comes.
Got it. What do you challenge? So for you to attract, the challenge is, the gentleman said, you just need to know where they are to attract, right? You may have a bigger magnet, but then if there is no steel around you, there's no point, right? You need to know where the steel is so that you can go place a magnet there, right?
Attract part comes in having identified your customers, then that's when attract part comes in.
Correct.
Yeah. So healthcare is you can, there are healthcare enthusiasts, there are patients, there are prospective patients probably, and that's where you identify them, and then probably a diagnostic center can have a different attractive strategy. Probably some appointment booking engine can have a different attractive strategy.
Got it.
But trying to put it into single bucket is I don't know. I can't.
No, I was just going to ask you what your challenges are in your current organization that you're running. What are the challenges that you have?
We have identified our customers, but the thing is, the trust part, as I said,
the problem is conversion.
Yeah,
because
conversion
of the
is
trust.
becoming difficult.
So you're done attracting part.
Yeah, attracting part.
You're done in either convert or acquire.
Yeah.
There's still sales process going on. Got it. Any other thoughts, sir?
Yeah, for us the biggest challenge is we know who the customers are, but reaching out to them in a most cost-effective manner.
In the most cost-effective manner.
That's the challenge.
Got it. So you want to convert, but then at a low cost.
Not even convert, even to obviously as a startup, you have to tell your potential customers that you exist.
Correct.
That's the attraction part.
Got it.
Just to tell them that you exist without actually spending money on IPL or KPL, it's a challenge.
Got it. Okay, so cost is a challenge. Knowing where the customers are is a challenge.
Value for money. What kind of services you are offering at what price?
Got it.
And price sensitivity.
Got it. Price sensitivity of the service offered or price sensitivity. So this gentleman has price sensitivity to reach out, right? To reach a customer itself, he has limited amount of budget to reach the customer.
That is one.
Yes.
The second one is
The cost of the service.
cost of the service.
Cost of the service.
Having competition in the line, and then you are entering something.
So is that the problem at the retention or is that a problem at the conversion?
At the acquisition itself, it is going to be a problem.
Correct.
Because
The
there
cost
are
of the service is
players
high.
Which are existing, large players. How do you compete with them? How do you offer your services?
Got it. Okay, so my personal perception here, right? Few things that I have, most of these, I think a few points that I have covered in terms of what are the few areas that we could, focus on, right? When there is a problem of identification, how do I identify? When there's problem of low cost, what can we do? When there's a problem of conversion, what are the few things? Hopefully I'll walk you through a few of them. Yes, sir.
I just want to qualify this further. Most of us are startups.
Yes.
Then there's a value proposition that we're trying to get across.
Yes.
Because all of this stuff is new, right? So messaging the value proposition, having the changing customer behavior to come to you is the basic challenge. When I say attract, it's about helping the customer understand the value proposition on the changing methodology of when you say health tech, health has been going on. And when you say health tech, that is pushing the customer to change his behavior as well as the practitioner in the way business is done. Now, that is a big message that needs to go out. And that is what, and that's a big job, to try to help them just by messaging for them to change their behavior and change from health to health tech. So basically, health tech I understand is an enabler.
Sure.
And we are trying to make things more efficient. But here is where the general problems of attraction and moving them down the pipeline is concerned. I'm like, from an awareness perspective to conversion, that is where I see a lot that needs to be, so a lot of good thought needs to be going into that, and all of us are battling with that.
Sure, I share the same concerns as well. Don't have a yes or no answer for most of this because each problem gets hit at a different level, right? Look at it from a phone industry went through this transformative process, right? We had all those, keypad dialed phones, and then when the mobile phones came in, they solved the problem by giving a cost as well as ease of use, right? They made it a little more expensive, but then the convenience that you get to carry a mobile phone was taking the whole thing out, right? Hopefully somebody comes up with an idea to attract and maybe you kind of do some value proposition that could that your customers would be able to talk about. So I also thought we wanted to define how we perceive customers as, right? A lot of us have this confusion of whom do I call a customer, right? A lot of e-commerce world going on now, right? Even health tech online, there are a lot of people selling health services online, right? So how do we define a customer, right? We have to be a little more pragmatic in terms of defining what a customer is, right? Just because you gave a discount, he came on board, do you call him a customer? Right? You go buy it on Flipkart or Jabong or maybe one of your online health services. Do you call him a customer? Right? Maybe in the initial days when this world was not there, right? Yes, you could call him a customer, but now in the given scenario where everybody wants to acquire a customer at lesser cost, yes, for you it's a problem, but when you have a gorilla, right, that comes in and throws a discount, now gorilla treat him as a customer, right? Big question. Same thing, you have this discount coupons coming in. So I think we should all evolve to a place where when you really want to have a customer, right? A customer is acquired customer. The acquisition definition is not the first time when a discount is given out. I think successfully you will have a customer acquired, right? When you own that asset or, right? Acquisition is basically an asset acquisition, right? If you really go back to the dictionary level of definitions, when you say I acquired an asset, which means, you just kind of own an asset, right? So even for the customer level, right? When you go ahead and own that customer, when do you own the customer? Not when you just give a discount coupon and let him come back, right? When he comes back again and again, that's when you tend to own a customer. So from a marketing sales to a customer acquisition, right? If you step back and redefine what a customer acquisition could be for your startup, right? Yes, you've done your marketing, yes, you've done your sales, but if you want to have a good customer acquisition strategy, right? You should have something where you know the customer, and you have acquired the customer. You have not just had a sale on the portal. You did not just have a sale of one-time services, right? You should have acquired, meaning you should have owned the customer for a period of time. If your services are limited to 1 year, maybe your whole acquisition period is 1 year, so you have acquired the customer. If services are long-term in a chronic management, maybe multiple year. If it is just one-time review like Practo, maybe that itself is an acquisition. So customer acquisition is a little above and beyond sales and marketing. That's the one that I wanted to talk about. So going forward, right, just wanted to tell you there was this precisely this point that came up here. How would I have my customer acquisition strategy? First thing is, before I even go there, how would I have my customer acquisition strategy? What do I do to have a customer acquisition strategy? First thing is, you need to know where your customer is, right? You need to know what the characteristics are for your ideal customer. Right? Who is your ideal customer? Right? To know that, there are enough frameworks available. All you have to do is look up for ideal customer profiling frameworks. Typically, right? So there are a bunch of questions people ask. Okay, what do you do? What kind of services do you offer? First, you identify who your ideal customers are. For this event, I can walk you through the conversation between me and Sridevi. Who are the ideal customers for me? Right? Is the guy who is visiting Apollo Hospital, is he an ideal customer to us? No. Right? Is a guy who met with an accident ideal customer for us? No. So we went through the process of where are the who is the ideal customer, and figured out, okay, a bunch of companies and startups for the bootcamp who would be looking forward to get some help. Right? So we profiled, we made sure we have ideal customer profiling done, so we know where our customers are. Right? So part of the strategy, first thing is you just put your mind together, open this ideal customer framework, profile framework, profile your customers, make sure you know who could be targeted. Should I target a guy from a college? Should I target a guy in the industry? Should I target maybe some networks? Right? So if you can put your thoughts into the framework, right, hopefully you will evolve and identify, okay, my customer ideally could be so and so. Right? If any one of you want to just stand up and talk about your company, and then we can walk you through how do you identify your ideal customer, we can also do that right away. Anybody willing to do that? Two hands raised. First goes here. Yes, sir. Can you talk about your company, and then let's see if we can just take a quick.
My company is like patient engagement services.
Patient engagement services.
Right.
Okay.
So what I'm focusing on the kind of chronic areas where there are a lot of dropouts for the patients. So where I want to help doctors so that I can bring back the customer back to the hospital, a clinic.
You want to help the doctors get patients to the clinic.
Correct.
Okay.
So my acquisition challenge is now getting the doctors. So how I know I profile the doctor.
But you have your ideal customer is doctor. So you already know that your ideal customer is doctor.
Correct. So ideal customer is a doctor, and is that to the chronic areas.
The doctor in a chronic area is your ideal customer.
Correct.
Okay.
So the challenge I'm facing is like I know I get the doctors list of them, but acquiring them finding the doctor's time is one challenge. Second challenge is selling the service to the doctor is one other challenge because
Sure. I think the point I was trying to go is if you can walk through the challenges in identifying the customer itself. So you've completely decided that doctor is the only ideal customer. Correct. Nobody else is ideal customer. How did you come up and say doctor is going to be my ideal customer? My ideal customer profile means doctors. How did you arrive at that point?
So I build value proposition to my service, and who is getting more value on the chain.
Okay.
There is a change, like not doctor only the one is getting more value proposition. So doctor is one of them, like patient, doctor, diagnostic centers and pharmacies. So these areas I did a value proposition.
Okay.
And the doctor is the one point where I can get the customer, so I can sell it to the doctor.
So doctor becomes your reseller.
Right.
So you want to convert doctor into a salesman as well.
So here is
as part of your ideal customer profile then.
right.
Okay.
To the doctor, I want to get the revenue.
Got it. Okay. So looks like Ramesh seems to have completed his ideal customer profiling based on value proposition, right? So he seems to have complete clarity in terms of what his ideal customers are. And anyone? Yes.
Is it that the doctor is ideal customer? Is it that the doctor is your target customer?
Ideal customer is supposed to be a target customer as well, right?
In the target customer, you look for ideals. Okay, so if I say healthcare is my target market, within the healthcare, I say GSK is my ideal customer.
Yeah.
Because GSK can take a lot of my services.
Sure.
And GSK probably will be
He's already in
able
the
to
healthcare market, so he knows where
That's
the
what I'm
target
saying.
focus is.
So I'm just trying to clarify that part. So
into the doctor.
correct.
Doctor's efficiency to get more patients.
Absolutely.
Value proposition.
That's right. So that's why doctors are your target customer, target
And he
market.
seems to be knowing a little more. He also mentioned a word.
Right.
He said, chronic. I
Right.
also heard chronic. So he has the target in mind. So
Okay.
he's narrowing it down. When he profiled it, he did not say how he profiled it in that manner, but I could hear the words clearly that how he profiled, right?
Sure.
He profiled, this is entirely healthcare. This meeting is entirely healthcare. So the target segment is not like, e-com wide, right?
Absolutely.
We're still focused into healthcare. Even in healthcare, he seems to have clarity in terms of, where his ideal customer is, and his profile, should his customer be the laboratories, pharmacies, doctors, who are his ideal customers. So he did a little more profiling, and even then, I think he sub-segmented it into chronic, and he has access to the list of chronic doctors as well. So he's done a lot of groundwork to profile the ideal customer, and then I'll come to you. There's one question.
We are into affordable healthcare. We help already diagnosed patients with surgical illness to get surgeries done at affordable and fixed prices.
Okay.
So my target customer is a patient who is battling a surgical illness.
Your ideal customer would be a guy who has surgical illness, but he doesn't have either money or reach or whatever to go get it done.
Yeah, little apprehensive about the cost of healthcare.
Wonderful.
So he is going shopping across hospitals to look for a better deal.
Got it.
So my target customer is that.
How did you
patient.
arrive at that?
It's we have targeted basically in India 65% of our population, they are not insured, so they are out of pocket spenders. So these patients, they go shopping across hospitals for their surgeries. So what we tried is we onboarded about 40 hospitals to give fixed prices for a fixed set of surgeries. So we cater to these patients through these hospitals, accredited ones.
Got it. I'm still, it's unclear to me, how did you arrive at, yes, I think the hospitals have become your partners. They're not your customers. You still, if you have to step back, you'll still have to help us from the thought process on how did you navigate through and define your ideal customer is a guy who is waiting for surgery, but he's shopping around. That's your ideal customer.
Yes.
So all customers who are basically need surgery but shopping around. That's your ideal customer profile.
Yeah.
Wonderful.
Yeah.
Okay.
Who is not insured?
Not yet insured.
Yeah. Out
Okay.
of pocket spender is my customer.
Got it. Perfect.
Can I respond to both of them?
Yeah, sure.
I think that's not the ideal customer they're talking about. It's the go-to-market strategy which they are implementing to acquire. The ideal customer is the patient. Doctor is the means
to
for
serve.
him,
Sure.
so that he gets the patient. It's like a mutual customer.
Mm-hmm.
Doctor also, patient is the customer, and for us also the patient is the customer. So the go-to-market strategy is tying up with the partners, hospitals, or tying up
For him,
with
the hospital is a go-to-market
hospital,
strategy.
and for
yes.
him the doctor is the partner of the go-to-market strategy to the ideal customer is the patient. So that's the confusion which is happening.
So,
a small confusion actually. Here, patient is the consumer, hospital is the customer. Because hospital will pay for your service, patient will utilize your service.
So-
That's the consumer and customer.
So if you have clarity in terms of who your customer is, right? At least from an acquisition strategy, right? You should have a little bit of clarity on who your target customer is, and it becomes much more easier for you to go reach out to that particular target customer, right? Now, that's the first part of the discussion. Now we are spending a lot of time. So first thing is we need to, in the acquisition strategy, right? Now you need to understand the target market, right? Where your customers are, where your ideal customers are, after you have gone through a few of these iterations, right? Next one, how do I reach them? Right? I know my target customer is a doctor like this, or a patient who is running around. These are the people that I want to reach out to. That's your first step. Whom do you want to reach out to? Right? The second step is, where are these guys? Where are these guys? Right? How did you? So you talked about companies, guys without insurance, shopping around the hospital. But where are these guys? Right? If you know where these guys are, right, it will be much more easier for you to reach out to them. Right? What are they trying to do? Right? What is competition trying to do? Right? How much are they willing to pay? You need to understand a lot of, how are they making buying decisions? How much are they willing to pay? Right? Let's say if, for you it's a classic problem of how much are they willing to pay? They're willing to pay only 500, probably 500 rupees for a particular diagnosis, or only 1 lakh for a particular surgery, right? So you need to understand both of these words. You need to know what is my customer look like, who does my customer look like, and then where is he, what is he willing to pay, what my competition is doing to lure him, are they just dropping discounts and take care of them. So if you have this level of clarity at a very top level, I think you can effectively stitch more plans together to really go start a marketing campaign. Even if you want to start a marketing campaign, you need to know who is your customer, where they are. Right? You just can't go advertise in a cinema theater if your real target audience is probably shopping around at a hospital. Right? You're better off putting a hoarding somewhere near the hospital. So all these marketing strategies evolve if you understand where your customers are, right? Who your customer is, where your customers are. So some of the things that could help you with identifying these customers and then narrowing them down a little bit more, right? There are profiles like ideal customer profile framework. So use a framework. Maybe you will evolve beyond one particular customer, right? Your customer may not be just one segment like just the doctors or just the patients. Maybe you need to do both, right? So you will have much more clarity if you run through a particular framework, right? There are enough frameworks available for different market segments. There are frameworks available. So pick your framework, run through your thought process. Once you have that clarity, you know where your ideal customer is, right? And then define your goals. What do you want really from those customers? How do you want to reach them, right? And then the few other things that you could do to run your process successfully, right? There's always you reach out to 100 people, but only 3 conversions happen. What's going on, right? You need to know. These are little more gory details in terms of what do I do to acquire them, right? I think the key point that I wanted to bring out to all of you is identify who your customers are, right? Identify, are they willing to pay for that service, and then basically just run through a process. Very simple process. This is not like a great process. Get your ideal profiling done, right? What are your goals really? Each company will have a different goal, right? You may want to just have more visitors, more footsteps is your goal, right? Which is the more visitors, right? Or do you want to convert? Your goal of this particular acquisition strategy is just from number of visitors to actually a lead, or from a lead to buy. What your goals are, right? Most of you, I'm sure everything is a goal for you, but each company will be having a particular challenge to run a marketing campaign. You probably have a lot of visitors already, right? Because of cost of service, a lot of people may be going away, right? So which means you already have more visitors. You have visitors to lead conversion done, but your challenge is still just leads to paying customer is the only challenge. Maybe you need to focus on getting your customer acquisition strategy a little more refined towards this particular goal. So you need to pick out a particular goal and then define what you can do to break down the journey, right? Each step you just break it down and understand, okay, where are the leaks, right? Yes, there are conversion problems, but then where are the leaks, right? Anyone wants to flow through the acquisition process? Any company, you may want to just pick out a problem and then we can probably take you through real-time examples or some solutions around. Anyone willing to do that? Yes, I have there's a show of hand here, I'm sorry. Okay.
So ours is a very... If I'm audible, I'll just switch the mic.
Sure.
We have a very unique proposition. So we are a B2B business, we're not a B2C. So I'm a co-founder of a company called Hot.Life, which starts for health on demand. HOD's health on demand. So we have built a technology where we have a smart chair and connected devices. A user can sit on the chair and in 7 minutes we do a whole health diagnosis and give him a health report instantly. So we cover about 18 tests, which include about 12 non-invasive and 6 invasive tests, including blood sugar, triglyceride, cholesterol, and hemoglobin. So our main target market is corporate employees, which we have been very conscious in choosing. And our
So can we break it down?
Sure.
I want to make sure we just flow through some thought process. The first one is, so that's your product that you have built.
Yes.
And the service offering around it.
Yes.
Now, can we go through how do you come to an ideal customer profile? What is your ideal customer profile? So you have this chair, right? That can give you some health report, right? That's his product. Now, who are his customers, right? Who are his customers? So he seems to, directly go towards corporate as a customer, but then who are his customers? Anybody could be a customer. Big bucket. Next.
Healthcare enthusiasts.
Healthcare enthusiasts. Okay, a little narrow, from anybody to people who are healthcare enthusiasts. Okay.
More disease management, basically people who are looking for a solution to it, who also want to know the state of their health.
Okay, health enthusiast needs to know the health. Okay, who else could be his potential customers for this chair? Chronic patients. Okay, health enthusiasts and chronic patients. Okay. Oh, you want above 40 years only. You want to target only above 40 years is your ideal customer. Okay, interesting thoughts.
People who are pressed for time, they want quick results.
Pressed for time, quick results. Okay.
Sports persons.
Sports.
Sports persons are nowadays looking towards fitness things. Like for example,
Health enthusiasts who are active health enthusiasts.
Sports persons who are players.
Got it.
Actually, I would use value-added service at gyms.
As at gyms. Okay, wonderful. So look at the diversity of potential where your customer, who your customer could be, right? So with so many options available, right? You tend to choose a corporate as your ideal customer, right? Which means he has gone through some profile in his mind, right? The profile could be, are they willing to pay? Is it a problem for them? What is going to be my value add? So there's a lot of thought process that goes in before you kind of come back and narrow down to a particular ideal. He is my ideal customer, right? So let me just go back. So you have profile, right? After profiling, what did you do? What was your goal?
So the immediate thing we wanted to achieve. So we cannot get into. So I hear three people mentioning chronic as a target market. But so the devices that we use are US FDA 510(k) cleared. So we have been very conscious in not entering the chronic and clinical areas. We don't address those clinical and chronic just because of the kind of bureaucracy and the regulatory issues involved in clinical and chronic care. So we have been very focused on wellness as a segment, and then we kind of drilled down into where and what kind of customers we can probably target.
So you've done your ideal customer profile now. Goal, what was the goal?
The goal was to get
To just reach out to them, or to get them to pay, or to just get them to use your service. See, at the different stages of your company, right?
Right.
If you're still in a prototype stage, your strategy for customer acquisition is for you to have 100 people come in every day, sit on my chair, have the diagnostics and go for free. Right? That could be your target. So what were your goals?
So initially our goal was to fulfill about 10 health checks per day. Because
10 health
10
checks per day.
chair per day.
Per chair per day.
Per chair per day.
Got it.
Because it takes about 30 minutes, 7 minutes for a health test, and then we have a nutritionist who is the health operator who advises the customer on his health status and gives him a health plan.
Got it.
So we took time to
So you clearly had a goal, 10 customers per chair per day.
Yeah.
That was your goal. Wonderful. Okay. And he also knows that he can't do beyond 10. It's a 30-minute cycle, right? You're already doing 300 minutes, which is close to 6 hours. 6 hours of high occupancy on the chair, right? So he seems to know what his goals are. And then what happened next? If you had, did you get a flood of people to?
Yes. So we did pilots initially. When we launched in November, we did pilots. So first thing we did was to deploy it in two health chairs in a retail setting and 2 health chairs in a corporate setting, which is a.
So your ideal customer profile, though it was corporate setting, you did not have a clarity on who your ideal customer is. Is it in the retail chain or is it in the?
No, we had good clarity, but we wanted to identify the best strategy to acquire.
To reach the ideal customer, do you go through a retail chain or do you go through a corporate chain?
Yes.
Okay, perfect.
That's right. So when we deployed at a retail setting, we did one in Amanora Mall in Pune. We had very good insight on the kind of the mindset of the user. So usually the people that we attracted in a retail setting were people above 40, as gentleman mentioned. Mostly between 40 to 55, majority above 55. Because they were very keen on checking their blood sugar levels, because they are diabetics. A few patients who wanted to check their BP. These two were the most famous tests. But the payment that they were willing to make was between 400 to 600 rupees, not beyond that. Right? And on the other hand, the deployment that we made in the corporate, we've been very careful in trying to pitch it as a stress management and wellness deployment in the corporate. There we were able to attract people right from the age of 23 right up to 45 and 50 above. So there was no limitation, and our health station was booked out for more than 3 weeks. So
Who paid for that service? Did a corporate pay or the individual pay?
Initially in the pilot, the first 3 days of deployment was free because we wanted to
Got it.
do a pilot. After the 3 days, we went back to the HR head and said, look, we did 3 days, but we have this list of employees who want to do it, and it will take us 3 more weeks. But we have other deployments in Ericsson. If you want, we'll stay, or else we'll leave. But if you have to stay, we need to get paid either by the customer or yourself.
So who paid ultimately?
HR.
HR paid. So the company paid.
Yeah,
So
because every corporate has a HR and wellness budget which they have to utilize. They have a 3,000 to X rupees per year towards a contribution to the employees' wellness and health. So what they do as a part of that package is every year they conduct a health check. Some lab comes in, they do a health check and give a health report, which is basically just thrown in the dustbin.
Got
Nobody
it.
cares about.
Okay, so I'm just trying to distill whatever you said and trying to fit into the strategy flow here on which stages that you went through. So you had the profile done, wanted to reach out to a particular segment, but then you choose your partners to go to the market and then get them to use it. And then you knew your targets and goals, what is going on, and you also knew your funnel, where the leaks are. They're willing to pay so much only, this is your profile, so there's a lot of thought process went in. And then finally, you were able to hit the numbers that you wanted because you had some budgets from HR and other competition.
Yes. So ideally, right now our ideal deployment, today we are having 2 deployments in GLS. We've got the place where the HR is deducting 800 rupees from the user's paycheck, and
Got
the
it.
user is paying 200 rupees from his pocket.
Got it, got it.
So even though the HR is paid, we've been very clear in not making it a free to user service because we did not want the user to get used to a sort of free service. But the moment he starts, so we were very specific on making him pay, even if it is 100 rupees or 50 rupees that he's paying, we were very specific that he has to.
Got it. Okay. So if you've seen it while he's talking so much about execution, I can actually, I was trying to put everything into bucketize into which stage he's going through, right? I'm sure he's gone through these stages and very short period of time. I'm not able to relate really back into the every single stage of acquisition process, but I can broadly get that you went through, you had a profile, you used the partners to reach out to that profile, and some partners profile, through some partners some profiles did not work. Through some partners, there's some profiles worked, and then you refined it quickly. To meet your goals and metrics, you identified. Again, I clearly see that you had this level of buckets there, right? And you had unidentified customers to begin with, and then you had really a prospective clients, and then you converted them quickly to make them into existing clients.
Yeah.
Right. So wonderful. And any other thought process in terms of how you run through a little more structured way?
See, he identified his business as a business-to-business offering. Whereas he's trying to reach out. If it's a business-to-business offering, which is using a product, then he needs to go to agencies which use that product. In the sense, he's now trying to profile customers, going to corporates, making end customers pay. That's not a business model. The business model was business to business. He should have made sure that there are businesses who have their end customers, who will acquire the end customers where he's busy selling the chairs.
So from what I hear, right, it's a short period of time to kind of conclude what went on. He's probably spent like years to get to that point, right? But what from my little bit of analysis that I could get, initially got his customer, whose ideal customer was wrong. Yes, he wanted to reach a customer, but then he couldn't make them pay directly because there was a payment problem. Right? Immediately, he stepped back and said, "Oh, that guy is not my customer. My corporate is my customer now." So he was able to quickly convert. Yes, through corporate, end customer is somebody else, but for him directly, for his chair directly, if a corporate, he can sell it to the corporate. It's up to corporate to go because they have budget, they have their own motivation. They will use this
So
chair.
there has to be a minor differentiation or segmentation here. Is he selling a product or is he selling a service? He's selling. Is he selling the chair or is he selling the service from the chair? That has to be understood.
So once he's given it to the corporate, I believe he would have done a background of what went on inside.
Yeah, actually, let me clarify your question.
Yeah.
We are not selling the chair.
All right.
We are not selling the chair. The chair is an engagement point for us to sell the services around the chair.
So that needs
Got
to
it,
be
right?
And from day one, actually this whole idea initiated because we did a small program for IBM in Bangalore where we did a health check. And then when we went in as a technology partner, in fact we were very clear on day one that our target market itself is corporates. But then we extended that model and said, okay, this is not just B2B, but it's a B2B2C, wherein the corporate subsidizes a majority of the health check and the user pays for the services except the health check. Because we knew at that point of time that corporates are already paying for health checks. We knew that the market is there, the money is there. Now what else can we make from that engagement was the challenge at that point of time in 2014. And that's how it evolved from there.
Sure. So again, to step back, right? From what I see, there's been from a customer acquisition strategy point of view, they also evolved. Right? They try to, they thought there's one customer, but then they channeled it to a different places. So the things that they changed a little bit to do this. As long as you can change it a little more faster, I'm sure you will be able to survive. And he's probably here because he probably survived that plan as well. So just step back and come back to the strategy point of view, right? if you have a strategy and if you just flow through a framework, right, the thoughts of acquisition becomes a little more easier, right? When you know that you want to acquire a corporate, right, and at his point, right, his marketing efforts will be limited to corporate marketing. He doesn't have to go do retail marketing, right? He doesn't have to go to retails and market. So his marketing plan basically evolved out of his customer acquisition strategy. So if you have a startup, right, first thing that we tend to do is just go hire a guy who can do marketing, right? That seems to be a lot of mindset that we have, right? Marketing guy comes up and says, what do I market? Where do I market? Right? Yeah, I'm ready to market, right? Plenty of marketing channels available, right? I can go write a blog, I can go do this, I can go host an event, carnival in high-techs, invite 10,000 people, I can pull all of that together, but what do I do? Right? For him, for the marketing guy to have some clarity, right? You need to have an acquisition strategy, customer acquisition strategy in mind. So it's much more important for most of the startups to have a customer acquisition, probably the founders or somebody who is thinking about customer acquisition and the strategies together, right? Before you even get into the marketing stage. Once you have the clarity, it will be much more easier to run a particular campaign. Marketing is still a long term, right? It's not, we just saw that in the slide as well. Right? It's still a long term where you're just going and evangelizing about stuff that you're not actually selling. So even to get there, right, you need to step back and have something called customer, right? And also, we just talked about who your customer is. Customer is really an asset. An asset is something that you actually own. Customer is not your, discount coupon user. Customer is your asset. If you want to really acquire this customer, right, you need to have a strategy in house. To get to that strategy, you probably need to profile your customer, you need to understand where they are, and then come and do the marketing campaign to go evangelize about your product, about your service, right? Then comes in sales, where they try to convert. We also looked at buckets, right? It was unidentified area, at least from marketing perspective. So we went and reached out and generated prospects, right? Marketing campaign probably generated prospects, then gave the prospect leads to the sales team. Sales team applies their own filters in terms of, okay, what is the value of this guy? Can I convert him at this cost? Is he looking more than what I can sell? What are my problems at the sale? So he will distill that as his own problem and sale happen one-to-one. That is when you actually get a customer on board. So it's a detailed process. Please step back or step up a little bit beyond marketing and then start thinking about acquisition, and then have an acquisition strategy in place, which would go a little more longer way in getting a clarity in terms of who your customer end of the day would be. Right? That's the gist of the story. And that a few numbers that I had, I'm not sure if you probably know this already, right? Most of the fancy word nowadays is, what is your CAC, right? What is your customer acquisition cost, right? It's the cost to acquire a customer. But then to acquire a customer, it's not one number or one name, right? It involves the whole life cycle of the customer in terms of how much do I spend, what do I do marketing in a given time, how many customers do I get, and then what is their lifetime value, right? How many years, even if I spend so much, right, and then I acquire a customer, how much is he willing to pay? So there was a concern in terms of I have a limited budget, right? You may want to expand a budget if your LTV is a little higher, right? If your lifetime value, the customer is going to stick on to your service, and then you make money out of, let's say, you're going to make about 1,000 rupees every month out of a customer, and if that customer lifetime value is probably 3 years, right? You're going to sit on a huge amount of money from a LTV point of view. Of course, lifetime value is all projections. If you can actually retain the customer as well. So if you have higher LTV, you should be able to translate that money back into your customer acquisition cost and maybe enhance your customer acquisition cost so that your LTV is also sustainable. Ideal numbers would be 3 times more than your what you make money. If you can just spend 3 times lesser than what you make money, you're still fine. So to get that budget in terms of how much do I allocate to my marketing, sales, retention, including your back office to retain the customer, all of that, right? Associate a value to it. And if that value, look at your lifetime value, look at your customer acquisition cost, and maybe you will be able to evolve your acquisition budgets. That could probably make a little more sense.
I have a question.
Yes.
Customer acquisition cost, that's something that I don't have a clarity on how a startup which has a handful of customers right now
Yeah.
has just started.
Yeah.
How do I arrive at this cost of acquiring a customer? Because I must have put in a lot of money just to have the product out there.
Sure.
And I have now a handful of customers. So if I calculate my cost today, it would be really huge because of the amount that has gone in.
Sure.
So what are those things which actually qualify to calculate the cost?
Got it. So one way I apply my own filter would be take my R&D cost out. R&D cost has nothing to do with customer acquisition cost, right? That is my cost of the product, right? To reach out to a particular customer, what did I do? First thing, as a founder, as a startup and a founder, right? I myself am spending X amount of hours to reach out to that customer. That is my customer acquisition cost. I also made a presentation to him, right? I went and probably to reach him, I used my friend network, right? So all of that you kind of put in some rough estimate of cost because as a founder, you yourself are doing it, right? That's only one part of the problem. Now, the second part is you can't do this sale every time. I'm hoping that you want to expand your team and then you really have a dedicated person who take care of customer acquisition both from marketing and sales. So you'll have to project some numbers to see how much time, let's say, to convert a particular customer, right? It took like 3 months, right? So 3 months of effort needs to be computed into your customer acquisition cost. So even if you bring in a new sales guy, if a founder is 100% efficient, if a new sales guy is going to be only 60% efficient, build that cost, right? To make the other guys, marketing, sales, all the team to be 100% effective, that's another challenge of yours, but that's how you at least tend to put in some cost into what could be a potential cost, right? See, acquire is not, just get, so to acquire, first time you may be throwing in a discount. That's also part of your customer acquisition cost. Or you may be giving a 3-month trial period, right? That's also part of your acquisition cost, right? And then they'll call up your call center. Somebody has to call up your call center and then ask, okay, how do I use this product? That's also your acquisition cost. Acquisition and retention. So you make sure you retain all these costs and then compute for a period of 1 year how much is going to be my acquisition cost divided by total number of customers that I would ever have. So per customer, this is going to be my cost.
So this is something that I basically project for the next year and have an approximate number.
Correct. You already have your past history, right, in terms of what you have done. You basically associate a little bit of cost into it and then project. That's how you're going to have acquisition cost. There are enough materials out there that will help you. If you just look for customer acquisition cost computation, industry specific, you will have huge amount of data. You can use those frameworks available to arrive at a customer acquisition cost, right? And then put an LTV onto it, right? Lifetime value onto it. Then you will know if you can actually enhance your customer acquisition cost or you have to reduce your acquisition cost. Based on that acquisition cost, number of customers, you can go and raise funds, or you can kind of tell, hey, I have extremely lean and mean acquisition cost. Invest more in it. Yes. Mike Bill.
I think two segments, like cost of acquisition and lifetime value, like these are two different things. I feel like the lifetime value, I don't see much of a clarification which you're given. But to acquire, yeah, obviously, like these are the things which you said, and also what she's saying about like the product development, which is the cost, but that is not customer acquisition cost at all, like, right? So can you just throw more light on the lifetime value? Like,
okay. So the lifetime value is the way we compute is this product cost. This is when the cost of R&D comes in, right? First initially I said discount the cost of R&D, right? So now you could have a cost of R&D, and then you probably have over a period of, let's say you invested about $1 million into building a product, pure R&D cost, right? And then you are expecting 1 million customers to use it, right? So per customer, the cost of the solution is going to be $1, right? Now if you sell it, you plan to sell it, or if you target to sell it at $1.50. So you have 50 cent, that is going to be your value, which is your profit.
That's the profit.
The profits that you're going to make out of that customer. Million customers, so about?
That's the entire life cycle.
Entire lifetime of, typically, you'll have, see, these are projections, right? They are not realistic numbers. You assume that you're going to be able to retain this customer for 3 years, and then you keep computing 50 cents every month, right? But then to retain itself is again a customer acquisition cost. So these are all projections, right? You will not get realistic data right now until you have a record of a year or a 3 month or some trial period that you actually go through. So at least if you have those goals and targets telling this is how my customer acquisition cost can look like, and then end of the year, you take a look at it and say, did we fit into this customer acquisition cost? Did we go overboard? Did we reduce it? And then look at lifetime value. Every year you need to review it. Okay, we thought of making per customer this much money. Are we making that much money? True. Because my LTV and CAC both are like tied up, right? If I want to aggressively go out and acquire customers, my cost of acquisition is higher, right? I need to do paper ads, I need to run a television campaign, a lot of customer acquisition cost. So to do that, you need to be able to prove that you have a good amount of lifetime value coming in from a lot of customers, or from fewer customers, there's a huge lifetime value. Only then it makes sense for you to invest so much back into acquisition.
It also ties into your revenue model, right?
Yes.
Yeah.
Revenue, the cost of operation, your R&D costs. So there are a lot of things that you need to be built in to arrive at an LTV.
Yes.
Right? When you have this LTV, it gives you some sense of feedback into CAC. Just the health of that, how strong your P&L is, right? But then you'll have, from the P&L, you'll have to derive an LTV.
Yeah, you divide by the number of
customers.
Profit divided by the
Correct.
number of customers. Or is it cumulative? Is the LTV is cumulative, like 3 years if you have a
Yes.
net profit?
Let's say if you have booked $1 million profit this year, right? But then if you think the customer lifetime is more than a year, then your LTV can be spread across more than a year. But then to retain that customer for that period, let's say if your lifetime, if your LTV computation is based on 2-year period, then it goes back to the retention team to make sure every customer average retention time is 2 years. Some customer may fall off in 2 months, some customers will stick for 4 years, but then your average retention at least becomes 2 years. So you will get some metrics that will give you some feedback to say, okay, if I have my 2 years window of average lifetime of a customer, not the value, average lifetime of customer is 2 years, my LTV and CAC makes sense. So it's a feedback cycle.
For business like ours,
Mm-hmm.
we cannot have the patient.
Is your lifetime, no, your lifetime value is just one shot, 1 month. Whatever is it, your duration is fine.
There's a post-surgery there.
Yeah, process,
I guess according to your business cap.
Correct.
You can't spend too much.
See, which is like, you have too many unique sales, which means your CAC should be higher and your margin should be higher. Per customer, you'll have to make more money so that you can feed that money back into CAC. Otherwise, if you're making less money and if your lifetime value of customer is just 1 month, you can't sustain that model for too long because your acquisition cost versus lifetime value, they just collapse. So you'll have to feed back both the cycles. One way of, at least that's how I look at it to begin with. Or the CAC should be less, yes.
Yeah.
So, one more question.
In chronic disease management, especially hypertension and diabetes, once it is diagnosed, it will be lifetime with us. It may be 20 years. Nowadays, even it is now 40, 50 years also.
So your lifetime value potentially is
40, 50 years
He's
also.
in a good market. So you can make money leisurely.
So
but then
definitely there is a lifetime value will be much more if you retain the client.
that's a potential lifetime value, but then your sales team should make sure they renew the package every year, or they sell a 50-year package.
You have to retain the client.
Either you sell a 50-year package, which means your LTV is all, your lifetime is 50 years, or if you're selling a yearly package, there's a lot of stress on your sales team to renew it. There's a renewal stress.
Yes.
Hospital, they signed up these chronic renal failure patients for lifetime dialysis for a package of 30 lakhs.
Perfect. So their lifetime is higher, right? And then when you compute that value, you already sold them. So maybe you'll have to do a lot of CAC. But then since the lifetime value is so much, you could actually do a television ad. Maybe you could go, put it in a cricket match. You're fine with it because you're selling a 50-year package, right? Every year you're going to make money. That is guaranteed. So it all depends on some parameters to. If your package is 1 year, then there's a lot of stress. If the package is longer, go advertise. You're fine. But then this is all feedback for you to understand how much money you have to raise as a startup as well, right?
You're right, because we were able to sell packages for hypertension and diabetic patients, healthcare nutrition plan at corporates, and they've been consistently renewing every 3 months for the last 9 months. So I think that's a great place to have captive audience.
I'm sorry, I was checking on my time. Sure.
I was telling that it works because what we noticed is the biggest subscribers which we were able to retain are diabetic and hypertension patients.
Mm-hmm.
They were the only ones who were willing to pay for a subscription model.
Got it. Sure. I think, again, if I have to broadly just summarize, right, I would still go back to attract, acquire, retain. Retention, again, is delighting. If you don't have a problem of retention like Apollo package, you're fine. But if you have a problem of retention falls back to delight. If a customer is delighted, only then you will be able to retain him. Right? To acquire a new customer, it's going to cost more than to retain him or delight him. So I want to rephrase our attract, acquire, retain as attract, acquire, delight. Right? The cost of delight also is going to go back into your customer acquisition cost. So please make sure that's also built in. Right? And then one of my personal views on the other side, right? Commodities are more volume driven. So you could just do volume, discounts, compete, a lot of them. But then healthcare is a little more value driven. So you'll have to give him, it's not a commodity out there. Right? People are not going to just throw you off. Once they're stuck with you, if you've done a good surgery, if you've taken care of them very well, right? He's not going to look at you as a commodity. There's a few slides I had. Some of the references, if you are willing to go back and structure your thought process around the references, these are the references. That's the presentation I have, guys. Thank you so much for listening. If you have any questions, you could reach me offline as well. All right. Thank you.